Jeff Koslow gives some things to consider if you're going to go talk to your board, if a CISO is going to talk to their board about cybersecurity.
Let's start with Jeff Koslow. ExtraHop is a company based here in Seattle. I may have been the first healthcare customer for ExtraHop back in, 2008 or 2009, when they wrote in and saved my bacon with their network detection and response capabilities.
So he's speaking at him. He's going to be talking about if you're a CISO getting ready to go in and talk to the board, what are some things that you're going to do? He says, number one, know your audience. That's absolutely true. Not all boards are made the same. I know our board really only had one technology person per se on it. And that technology person was incredibly savvy and was like the spokesperson for the entire board. But it didn't mean that we didn't have to really be very clear and very basic about some of the things we were doing. We couldn't just speak to that one person on the board because our subcommittee of the board that handled security, we had to bring everyone along. We couldn't just speak to that one person. And actually, he was phenomenal because he helped to bring the rest of the board along as well. So you'd have to know that audience. Have you seen, I assume most boards today have somebody who understands cybersecurity.
I think so. If they don't have somebody on the board, they probably have somebody on one of the subcommittees of the board, like audit and compliance. And so somewhere in there is an external resource that understands cybersecurity. And you're right. I mean, I think cybersecurity for so many years led with fear, uncertainty, and doubt, scaring people into buying stuff for cybersecurity because, oh my gosh, what will happen to us if we don't? And I think the transition that has occurred, he talks about leading with resilience and managing fear, is that, yeah, of course, you're going to be afraid of what might happen. Nobody wants to be in the newspaper. Nobody wants to be the person with the microphone shoved in their face. But really, the story has to be now, I think, and based on what he's saying, I think he thinks that we've created this situation in healthcare now where you can't provide modern healthcare without digital health, without the tools that we have, EHRs and ERPs and the 1,000 other applications that many of us run, which has to run on relatively modern networks and is connected to the internet because we're doing a bunch of this stuff, as we talked about earlier, as a service. And when you get all of that put together, you have to be really thoughtful about what happens if we go down, what happens if we go offline. And so you have to talk about it and think about it from the perspective of resilience. If we're down for one day, what does it cost us? If we're down for 30 days, what does it cost us? And what are the things we can do to make sure that if something happens that we go offline, we can come back as quickly as possible to deliver great care to our patients and families, because that's what they're all about.